New guidelines surrounding COVID protocols have been put into place, with the changes being driven by recognition that an estimated 95% of Americans 16 and older have acquired some level of immunity.
Here to discuss those protocols and to help us understand the reasoning behind the changes here in Dane County, Jeff Pothof, Chief Quality Officer, UW Health. Doctor, good to see you again.
Good to see you guys.
So the CDC moved Dane County back into the high category on Monday. Well, up and down, back and forth, what's happening with that?
Yeah, so when we look at these community transmission levels, it really has two big buckets. So one is total number of cases, like how many cases do you have in your county? But the second thing is like how full, how taxed are your health systems? And as those numbers kind of come together, you can pop in and out of these red and yellow statuses. So like you mentioned, a week ago we were yellow, now we're getting back to red. It really is helpful in trying to educate folks on what level of mitigation should you take to both protect yourself and your community.
Let's talk about this 95% number that the CDC came out with. People either had vaccines or have been exposed. Is that herd immunity?
So not herd immunity in the sense that it doesn't mean that so many of us have immunity that the virus can no longer spread to other people. With these subvariants, people are getting sick, although more moderately with these Omicron variants. But what it does mean is that that risk of severe disease goes down because at least your immune system has some inkling of what it's up again. And that would bear out in what we're seeing in hospitalization data, where we see people hospitalized, but the percent of those that are in the ICUs is much lower, the percent dying is lower. So it's a good thing. It probably allows us to back down on mitigation, not because we won't have people that get COVID, but because the consequences of getting COVID aren't as dire as they were earlier in the pandemic.
Well, the Madison Metropolitan School District just announced that masking will be optional. So what does that tell us for schools going back?
Yeah, I think for a lot of schools they will be going to mask optional, and that might work, especially if our numbers are just a little bit on the lower side. As far as the risk to the kids themselves, if they really do have this much immunity and they aren't as likely to get severely ill, it'd probably be okay. I think the thing that schools could struggle with is if we have, say, really high levels of COVID, we pull away masking, staff may be out, and it might be hard to run the school if you have too many staff out. So that's one thing that I would watch going into the school year is the staffing, but the risk for severe disease is lower.
But the vaccination rate for kids is pretty low. I mean, parents just aren't getting their kids vaccinated for this. Why not?
Yeah, I don't have a magic ball for the why not. Certainly from the medical perspective, if you talk to doctors, pediatricians, all of them are going to say, yeah, get your kid vaccinated. We know that the rate of adverse events that people associate with the vaccine, say heart inflammation or blood clots, are many-fold higher in kids who actually get COVID. So you're not saving them there. And you likely decrease the risk of long-haul COVID, which could keep your kids out of extracurricular sports and drama and things like that. So if you haven't gotten them vaccinated, everything would point towards that being a good decision. Get those kids vaccinated.
Yeah, especially before we do enter into the school year to avoid any types of surges. I mean, is that really key for people to understand now?
Right. So vaccination, at least for a short period of time, will prevent you from getting any symptoms at all. So you can prevent surges. But even if the vaccines get a little bit older in the tooth and kids are getting symptoms, they're less likely to get more ill, which is a great thing. And decreases that risk of long-haul symptoms, which no one wants their kids to be fatigued and have brain fog.
Moderna's new vaccine got some initial approval today. We're targeting this BA.5.
Yeah, and so far, I mean, I don't want to jinx us, but right now BA.5 is the predominant variant. So Moderna having a vaccine that is hybrid is the old vaccine plus specific protection against BA.5 could be a good thing. I haven't seen good data on just how effective it is against BA.5, but the fact that it's specifically targeted and BA.5 is still out there, not a bad thing.
Yeah. Is it also important to remind everyone that, that this isn't fall of 2020. We're 2 years out. We do have these protocols and these vaccines to help us get through. I think a lot of people are nervous about the fall.
Yeah, no, absolutely. We're a completely different place this year compared to last year on a number of fronts. One, a lot of people have been infected or they're vaccinated, boosted. That reduces severe disease. We've got therapeutics out there that further reduce the risk of hospitalization. Yeah, I mean, you really can't compare it. And we're still talking about COVID. You need to be smart about it. But the risk to yourself, especially risk of severe disease or death, much, much lower today than it was a year ago.
But this thing has thrown a lot of curveballs at us in the last 2.5 years. Just when we think, okay, and then boom.
It certainly seems like it.
It's a wily virus.
Yeah, these viruses, like they evolve. They evolve sometimes quickly.
So we're still expecting to get a flu shot this fall.
Yeah, you want to get a flu shot. We could have a pretty robust flu season. So you know, if you haven't thought about the flu for a couple years, this would be a year where, when those shots are available, go ahead and get that too.
Yeah.
And you can get them both together?
You can get them together, but we haven't got a combo, so you're looking at 2 shots, not one. But you know, left arm, right arm, right?
Absolutely.
Balance it out.
Yeah, well, time will tell. As we say, you never know.
You never know.
All right. Jeff, good to see you again.
Thanks.
We'll see you next week.
See you guys again.